All right, turning now to news on healthcare in New York. There's a new push at the state level to breathe new life into the state's struggling home care industry. It's becoming harder and harder to find consistent and reliable home care in New York, and that in part is because there's just so much turnover in the industry. But lawmakers in Albany say that could soon change. Daryl Camp reports.
I'm gonna try this. What do we want? When do we want it? Now. What do we want?
Elderly and vulnerable New Yorkers were a big area of focus during the COVID-19 pandemic. From vaccination efforts to guidance from public health experts, many public health decisions made since 2020 were made with those groups in mind. But as New York begins to emerge from the pandemic, many problems still remain for vulnerable New Yorkers, some of which were made clear over the past 2 years. One major area of concern is a need for home care aides. Home care aides are a type of healthcare professional who works in a client's home as opposed to a medical facility. They're often essential to helping aging New Yorkers stay in their homes and necessary for day-to-day functions for those with disabilities. Paula Vereen is a home care aide in New York City.
The home care workers are doing it all. When they come down to the patients, we wear a lot of hats. We become the doctor, we become the lawyer, the supervisor, the social worker, everything when it comes down to the patients. A lot of the patients, they don't have anyone to care for them. And if it wasn't for home care workers, the patients would be out of it.
And as important as that job is, there's a significant shortage of workers in the industry. Many connected to home care say that's because of low wages compared to entry-level jobs. Home care aides earn about $15.45 per hour on average, according to federal data. That is just above the minimum wage in New York City and its suburbs. That minimum wage is currently $15 an hour, with many jobs starting much higher due to workforce shortages. Here's Vereen again.
I mean, it's not enough. It's not enough comparing to the way things is going up. It's very difficult, when it comes down to dealing with the, living wages. I think it's not enough.
That and a non-traditional schedule can lead to high turnover in the industry, and lawmakers in Albany are trying to change that. A new bill called Fair Pay for Home Care would raise the minimum wage for the industry to 50% above the standard minimum wage in any given part of the state. That could be anywhere from $19.80 per hour to $22.50 per hour. The bill would also raise reimbursement rates under Medicaid and managed care, which lawmakers say could help raise those wages more. Senate sponsor Rachel May, a Democrat from Syracuse, is the chair of the Senate Aging Committee.
Right now, in a lot of fields, they're paying workers more than minimum wage just to get the work. But in home care, they can't do that because the reimbursement from the state is too low. So this bill requires that reimbursement to go up.
Because the bill would cost the state money, lawmakers are hoping to include it in this year's state budget. That's due at the end of March. Whenever something is tied to funding, the legislature prefers to work it out in the budget where they can set aside money to make it work. This year is a little different than past years, though. New York has a budget surplus because of federal aid and strong tax revenue. Governor Hochul has said that she would like to save some of that surplus for a rainy day fund. However, Assembly Health Chair Richard Gottfried says it's raining.
We have a large surplus in this year's budget, but that means there are a lot of people demanding more money for everything under the sun. So it's a question of priorities. We're trying to make sure that health care, both coverage for all and fair pay for home care, are top priorities.
Increased wages are something the home health care industry has been fighting for years. And because they haven't seen much happen, they've felt like they're not a priority for lawmakers. Julie Farrar from the Center for Disability Rights says that's partly because people don't connect with the issue.
There is a lot of stigma around disability. There remains a lot of stigma around disability, even though being disabled is a natural part of being, and many people will age into disability and age into needing home care.
There has been some progress at the state level, but advocates say there's still a long way to go. 5 years ago, the state approved $55 million to raise wages for direct support professionals who care for those with a disability. But since then, prices have gone up for everything, while wages have stayed low. Assemblyman Angelo Santa Barbara chairs the Assembly Subcommittee on Spectrum Disorders.
And there are people that are still doing the work, but they're certainly not doing it for the compensation, because that has not been in line with what other industries have seen. And people, in some instances, are there because they have a passion for this work, but they just can't make ends meet anymore, and they're really struggling.
While there doesn't seem to be clear opposition to additional funding for the state's home care industry, that doesn't mean it's a sure thing in this year's budget. Supporters are watching to see what happens, and they haven't seen much in the form of a commitment from Governor Hochul's administration. Bill Ferris from AARP.
The Division of Budget and the governor's office are not coming to the table, and it's evident because there was nothing in the executive budget. So we're hopeful the legislature will do something in their one-house budgets.
Ferris says there's also financial incentive here. More funding for home care workers, he says, could reduce costs in the long term. But those who need home care say the state should be less concerned about the cost and more focused on the benefit to New Yorkers.
People are in nursing homes not because they're old, but because they need assistance with activities of daily living. And if they could get that in their home, that would be the right thing to do, the humane thing to do, the way to treat people with the respect that they deserve.
With the budget due at the end of March, we'll see if lawmakers act on the home care industry in a final spending plan. If not, it could come up again before lawmakers leave Albany for the year in early June.
Thanks, Daryl. Something to watch in the coming weeks.